Hi, thanks for coming to my TED Talk. I'm Elizabeth, and today I'm going to be talking about tuberculosis. I'm going to start with some facts about tuberculosis. One of them is that it is an ancient disease, but it is still deadly. It is one of the oldest known diseases. Evidence of it has been found in Egyptian mummies dating back over 9,000 years. And despite it being curable, it remains one of the world's top infectious killers, causing about 1.3 million deaths in 2023. Every 20 seconds, someone somewhere in the world dies from TB. It's not just a disease of the past or the poor. TB is everywhere, from developing nations to modern hospitals. The CDC is on the front lines of preventative treatment. The motto is preventing TB to end TB. It is a silent spreader. Tuberculosis is airborne. It can spread from a simple cough or sneeze. What makes it disturbing is that an infected person can spread the bacteria to many others before showing symptoms. So only about 5 to 10% of infected individuals ever develop active TB, while the rest carry it silently as a latent TB infection. Drug resistance is a threat. Multi-drug resistant TB, MDR TB, is one of the biggest global health threats. These strains do not respond to the most effective TB drugs, making treatment 2 to 3 times longer, more toxic, and far more expensive. Here is a world map of multi-drug resistant tuberculosis and its prevalence in the world. Non-compliance is a major factor in the development of resistance. HIV and TB are a deadly duo. TB is a leading cause of death among people living with HIV, as their weakened immune systems make them much more vulnerable to infection and progression to active disease. Social and economic burden. TB disproportionately affects people living in poverty, overcrowded housing, or with limited healthcare access, often trapping individuals and families in cycles of illness and poverty. Undiagnosed and untreated, it's estimated that over 3 million people worldwide have TB but are never diagnosed or reported, allowing this disease to spread unchecked in many communities. Differences between latent TB and active TB. Latent TB has no symptoms. In latent TB, you do not feel ill, you cannot spread TB to others, and usually have a positive PPD test and your chest x-ray is normal. But active TB, you have a bad cough, pain in the chest, many physical symptoms. You feel ill. You may spread TB to others. You have a positive skin test, and chest x-ray or culture are often positive. Population statistics of prevalence of tuberculosis in the world. India has the largest number of tuberculosis patients in the world. Global Tuberculosis Report 2023. One highlight is that 75 million lives were saved due to the efforts regarding medication and treatments. Pathophysiology and etiology of tuberculosis. What causes TB? The causative agent is Mycobacterium tuberculosis. It's a slow-growing, obligate, aerobe, non-motile, non-spore-forming rod bacillus. The bacterium has a waxy cell wall that protects it from most antibiotics and immune defenses. As mentioned, it's aerobic, slow-growing microbe. It mainly attacks the lungs, but it can spread through other parts of the body like the brain, the bones, and the kidneys. It spreads through the air from coughing, sneezing, or even talking. You can just inhale a few droplets and carry the infection silently for years. Extrapulmonary TB might affect the lymph nodes, and it may present as painless swelling in the neck, the spine, leading to back pain or even spread to the brain, resulting in meningitis. So this variability makes TB a master of disguise, often delaying diagnosis and increasing the risk of transmission. Here is pulmonary tuberculosis, primary infection, latent phase, and active phase. Here is a diagram showing when the infection is eliminated and if symptoms are present and what tests are positive and negative versus a latent TB infection versus subclinical TB disease and active TB disease. And as you may know, in latent TB infection, prevention therapy is the preferred treatment as there are no symptoms, whereas in active TB, multi-drug therapy is the preferred treatment. If the immune response fails, such as in immunocompromised individuals, the infection progresses to an active tuberculosis. In this stage, granulomas break down, releasing bacteria into the airways, leading to tissue destruction, cavitation, and further spread through the bloodstream or lymphatic system to other organs, miliary tuberculosis. So common sites of extrapulmonary tuberculosis include the lymph nodes, kidneys, bones, and meninges. So one of the criteria of diagnosis is the first clinical symptoms, presentation and symptoms. So TB doesn't always scream for attention. It creeps in quietly. The classic signs include a persistent cough, often with bloody sputum, low-grade fever, night sweats, and fatigue. And the fatigue is so deep that patients describe it as a sickness that drains the soul. So over time, people become gaunt and weak, which is why TB was used to be called consumption. Here is a diagram of the symptoms. A tuberculin test is a diagnostic test to indicate TB. So a positive MAN2 test indicates you have been exposed to tuberculosis, but it doesn't necessarily mean you have TB disease. The MAN2 test, it's also known as the MAN2 test. So during the test, a small amount of purified protein derivative, PPD, is injected under the skin, usually on the forearm. And after 48 to 72 hours, the injection site is examined for a reaction, typically measured in millimeters of induration or swelling. So implications of a positive result. A positive MAN2 test often indicates a latent TB infection, meaning that the TB bacteria are present in the body, but person does not have symptoms and cannot spread the disease. So the test is considered positive. There's a raised firm area, as I said, so it's greater than 5 mm. And a negative MAN2 test generally means the person has not been infected with TB bacteria. There are false negatives as well, but a negative test shows no swelling to the injection site, usually. If the test is positive, further evaluation is necessary to determine if the TB infection is active, so that might include a chest x-ray or additional tests. And false positive tests can be due to the prior vaccination with the Bacillus calmette-guerin BCG vaccine, which is used in many countries to protect against TB. So there may be further testing that will need to be completed. And the interferon gamma release assay is also a blood test used to primarily diagnose tuberculosis and to assess immune response to specific antigens. It's particularly beneficial for diagnosing latent TB infections, which may not show symptoms but can reactivate later. The test can provide results within a few days, making it a quicker alternative to traditional methods. Chest x-ray findings can help a doctor find nodules, masses, or lesions that indicate colonies of TB bacteria and damage to tissues from infectious bacteria. These usually show up as brighter patches of white on your lungs. X-rays can also help show the size, shape, and density of TB infections. Another diagnostic tool is the Gen Expert, and it detects DNA sequences specific to the Mycobacterium tuberculosis and also detects the medication or antibiotic aromepicin resistance by polymerase chain reaction. Results are often obtained from unprocessed sputum samples in 90 minutes with minimal biohazard issues. The test was developed as an on-demand near patient technology, which could be performed even in a doctor's office if necessary. Here are x-rays and scans and photo of extrapulmonary tuberculosis. Here are the medications used to treat tuberculosis. There's the first line medications, second line, third, fourth, and fifth line as well. The most hopeful part of tuberculosis is that it is curable, but treatment is tough. The standard regime includes 4 antibiotics: ionazide, rifampicin, pyrazinamide, ethanobutyl. These are taken daily for at least 6 months, and that's a long time, especially in areas where access to care is limited. And when patients stop early due to side effects or lack of support or misunderstanding, the bacteria mutate, and that is the leading cause of drug-resistant TB. And there's also another type of TB called extensively drug-resistant TB. There is also global vaccination programs, improved diagnostic and adherence support programs. TB rates have slowly declined. New research into shorter drug regimes and mRNA-based vaccinations offer real promise that one day this ancient disease might finally be defeated. Treating these new resistant forms of tuberculosis can take up to 2 years. It requires strong drugs with severe side effects. So newer drugs like betaquilline and difamide offer hope, but they're expensive and they're not widely available. Drug resistance is caused by incorrect prescription, erratic supply of drugs, poor quality of drugs, and patient non-adherence. TB resistant to INH, rifampicin, quinolones, and an injectable second-line agent is the definition for extensively drug-resistant TB. It causes a higher death rate than susceptible TB. It's a worldwide problem, especially in Africa, and it's amplified by HIV. Medication adherence, one of the most important factors to prevent drug-resistant tuberculosis. Take the right amount at the right time, the right way, and for the right duration. Most countries in Central and South America have universal BCG immunizations. The Canadian Indigenous communities receive BCG vaccine. Brazil introduced universal BCG immunizations. The United States has never used mass immunization of BCG due to the rarity of tuberculosis in the U.S., relying instead on the detection and treatment of latent tuberculosis. Studies are being conducted for the potential of new mRNA vaccines to help fight tuberculosis. Currently, the only approved vaccine for TB is the century-old bacillus, the BCG vaccine, which is widely used. But the study found that the new mRNA vaccine was successful in triggering an immune defense response that helped reduce TB numbers in infected mice. So in addition, the researchers discovered that for mice that had received the BCG vaccine, a booster dose of the new mRNA vaccine significantly improved their long-term protection. Preventative measures are very important in TB. such as hygiene practices encourage proper hand hygiene, respiratory etiquette among individuals, treatment adherence, ensure consistent adherence to the prescribed TB medication, screening as well in high risk communities or populations, and vaccinations in countries or areas where TB is very prevalent. So, when you hear the word tuberculosis, don't picture a disease from the past. Picture people today, mothers, fathers, children, still fighting this infection with courage and resilience. Tuberculosis has survived for thousands of years because it thrives in spaces we neglect: poverty, stigma, and silence. But if we act with science and compassion, it doesn't stand a chance against us. The fight against TB isn't just a medical challenge, it's a moral one. It starts with awareness and education, and all of us. Here are some key points. Tuberculosis is ancient, but still one of the world's top infectious killers. Actually, the top infectious killer. It's caused by Mycobacterium tuberculosis, spread through airborne droplets. Diagnosis is faster and more accurate with molecular testing. Symptoms include persistent cough, weight loss, and night sweats. The standard treatment is a 4-drug regime for at least 6 months. Drug-resistant TB is an emerging global threat, and prevention and early detection save lives. Awareness is key. Thank you for attending.